welcome to Unspoken, the podcast. In each episode, we bring you stories of resilience, vulnerability, and courage. Our guests share their personal or professional journeys, insights, and offering valuable perspectives on navigating trauma, finding healing, and reclaiming one's life. Join us as we uncover the unspoken truths of trauma, recovery, and the transformative power of storytelling. Together, we can find strength and vulnerability and create pathways to healing that honor the complexity of our human experiences. And today we have a really special guest. I welcome Divine Rusagara, a wellbeing training facilitator and counselor in MHub Africa. And Divine, you reside in Rwanda, is that correct?
Yes, I live in Rwanda.
Yes, thank you so much for being a guest on our podcast from so far away. It's nice to have the connection. Yeah.
Thank you
So
very much. It's an honor for me.
yeah, is there anything that you want to share with our guests about you and your experience?
So my name is Divine Rusagara, and I am a clinical psychologist, and I work at Mental Health Hub. It is a global organization that is based in Rwanda. And I've been working there maybe less than a year, but in overall, I have 11 years of experience helping people struggling with mental health and assisting them to have a well-being. Yes.
Wonderful. Is there a population that you specialize in working with, like children, adults, trauma, mood disorders? What is your specialty?
Mm. I don't think I have a specialty. Maybe I can explain that. In Rwandan history, there was a time that mental health professionals were very much needed. So we received a basic training. And for us, we only needed 4 years of bachelor's degree in clinical psychology just to be thrown in the community and starting helping.
Mhm.
But with 11 years of experience, right now I'm having my master's program in clinical psychology. So I think with my 11 years of experience, I much more find myself in helping adolescents more, though I help um, all kinds of people and all kinds of problems. But I really find myself when I am with adolescent people.
Ah,
Mm.
that's where you feel at home professionally.
Yeah.
Yeah, wonderful, wonderful. Okay, well, I thought I might just start diving in with some questions, if that's all right. Yeah, and feel
That's
free to
okay.
ask questions yourself as well if you have others. I like to have um I like to invite guests from other parts of the world because it helps us orient to problems and solutions in ways that we may not have considered when we're looking through our own cultural lens. So it really is such a gift to have you here. But also feel free to ask questions to me if you have some. Yeah.
Okay.
So in your experience, what are some of the most powerful practices or tools for fostering resilience in clinicians and the communities they serve?
So maybe if I speak from my experience.
Mhm.
What practices that helped me was, and they are still, the fact that I am grounded. And I talk about when I speak grounded, I mean, like for me, for example, I feel really grounded when I spend time and I connect deeply with my family.
Mhm.
That's where I really find resilience. And another thing for me is my spirituality, the fact that I practice praying and connecting with God. It really helps me. So I think with clinicians, what they need is this having the self-awareness of what is going on in their profession, how they feel day by day, And it is very important to really listen to your mind, listen to your body, to know when to stop a bit, to know when to take days off. That's what helped me. Yes.
Yeah, so it sounds like faith and family and also listening to your body and what it needs.
Mm,
Yeah,
mm,
wonderful. And
mm,
community, it sounds like, is
mm.
important to you as well. Yeah. Well, which leads me to the next question. What role do you see and feel a community and connection play in the healing process?
Would you mind repeat the question?
No problem at all. What role would you
Mm,
say that community and connection play in healing?
mm, hmm. That is a very good question. And I feel like we are social beings initially. And to me, when I am deeply connected with others, I kind of find myself, I kind of feel that I belong. So the community will give me a sense of belonging, a sense of acceptance. Yes, and it is against the fact it is against the loneliness. So when you are in the community, you don't feel alone. You feel the warmth of these people who surround you. So the sense of community when it comes to clinicians and other people who struggle with trauma and who are looking for healing, it is an important aspect of the healing process. It is, in my experience and in my understanding, it will not be an easy thing to heal alone, but it's easier when you are in the community. Yeah.
Yeah, when I visited Rwanda, that was
Mm.
something that I noticed as an outsider looking in. Our culture is very individualistic, and even some of the things I noticed were the proximity with which people stand close to each other and speak very intimately, and it's just a different. It feels much more connective to me, but also professionally, some of the interventions that were and are designed through a Rwandan lens seem to really lean heavily on social connections. Would you say that's accurate?
Absolutely. And yes, I will proudly say that in our culture, we are community people. For example, maybe if I start in the family, you will see that in families we are connected and we help each other. For example, in my home now, I have 9 people in my home, and I'm very proud. Like when we are in the living room, cracking jokes and all of that, I really feel at home. So we are basically community people. And
Mm.
you're right about that. Yes.
It is
And it
really.
really helps. Yes. And personally, I realized that I hate living alone. I hate being alone.
Mm.
Like community for me, I'm proud of that. I'm proud of um helping my family members. I'm proud of connecting with them. In my calendar, I'm sorry, I get excited when I talk about the the importance of family, the importance of belonging to a community. Like
Mm.
for me, I have in my calendar, I have scheduled for the whole year people that I will visit. And it is a tradition in our family that we do that. So we visit each other, we connect. And you're right, when it comes to the connectivity in the community, it's on the larger scale in my country. It really helps. Yes.
Oh, yeah, it is a really beautiful sort of hopeful vision of, I mean, that's part of what inspires me so much about Rwanda is the connectivity, especially, given the history that, it's been 30 years since is it 31 years now in
Yes.
1994. And the
Yes.
way
That is.
that Rwanda has recovered from that is resilience, sort of in essence, I would say. That's how it looks to me anyways, as an outsider.
Mm,
Yeah.
mm. Very true. And maybe if I come back to to the genocide, one of the negative aspect of the genocide is that it disrupted our sense of community,
Mhm.
and it disrupted the trust among people. And one of the good things that our government did was to really encourage reconciliation and to bring back that sense of connectivity. Yes.
Yeah.
So
There's a lot of
yeah.
intentionality behind that. It's
Mhm.
really something. Yeah.
Very true. Mm.
How I this is not one of our questions on the list, so feel free to not answer. I'm
No
just
worries.
curious how um socially, after when you have a history of division and in the United States we are struggling with that
Mm,
pretty profoundly right now. There's a deep
mm,
divide in our country. Um, and now I look at Rwanda today in the context of the history. And again, I experience the community connection when I'm there. It's very palpable. How on day to day, if people disagree on something, is it talked about or how does conflict resolution happen now when connection is such an important part of the cultural approach, or it's
mm,
an important part of culture, I would say.
mm. That is a good question. And I think, in my view, our culture is very interesting. And I think it plays a role in that. As Rwandan people, um, we how will I respond to this? We are not immediately direct people.
Hmm.
Like, I may think about something and I will not necessarily tell you like straight away. So I
Hmm.
think we find ways to disagree, but without hurting each other. And I think it's something that is rooted in our culture. Our culture, I can see that it is different from our neighboring countries where a person think about them something and then immediately tell. For
Hmm.
us to take, we are a bit reserved and it takes time. And I feel that it plays a role in how we manage our conflicts. Yes. So, and another thing when it comes to our culture is that I think it's related to what I just said. Um, like, we tend to maybe finding good ways to express our disagreement, not hurting each other and not really displaying these heated emotions. Yes.
Okay, so
Mm.
that, yeah, it sounds like connection, it takes precedence over sort of conflict or resolute conflict resolution or being correct, maybe within a
Mm.
conflict. Is that right?
Yes, I may say that is the case of it, where people are not open to express what I feel. Yeah.
Mm. And are there negative consequences to that, would you say? Not expressing?
I, of course, a lot. And because we have a lot of sayings, we have a lot of proverbs that say that you shouldn't put your things out.
Mm.
And so, yeah, in my culture, it doesn't, I think it's hinders our process of healing from traumas when we are not able to express what we feel, when we tend to hide our feelings and not being able to be open about certain topics. It really hinders that aspect of healing. And yeah, and I realized that, I think, and I was having this conversation with Janvier, my colleague, is that as as mental health professionals, because of that aspect of not being open and being maybe trusting to other people. We tend to be close to our feelings and emotions, and we don't share. Yes.
Mm.
Um, Maybe in Kigali, um, I have these examples of people who really feel, and they are mental health professionals, they feel like, I don't know, I don't have anyone to talk to about my challenges, my problems.
Mm.
And you will find people maybe who will go and find counselors in Kenya and talk on online because they
Mm.
feel that Kigali is very small. I don't trust anyone. I don't want to open. Yes, I think that that aspect of our culture not being direct really sometimes doesn't help.
I see. That's interesting. And how would you say, I mean, you just mentioned that people will go to neighboring countries to
Mm.
pursue counseling and therapy. For those that remain pursue treatment within the country, how does the inclination to hold it in play out in the therapy room?
Would you please maybe ask me the question another way? I didn't get
Yes,
it. Very
absolutely.
sorry.
Yeah, how does the cultural your culture, it tends to be more reserved in terms of expressing emotion. So how does that,
Mm.
like you're up against that in the when
Mm.
you're conducting
Very.
therapy. Yeah. How do you navigate that?
Maybe personally, you mean?
Yeah.
Um, I think for me, if you are asking me how I manage maybe to open up,
Mm-hmm.
um, it's something that I learned with time.
Mm.
First of all, I made a realization that it's not helping. This tendency of keeping quiet, keeping things to myself, it's not helping. And
Mm.
maybe I may attribute my openness to the fact that there was a time I worked for an international organization and out of my country. So I was exposed to many cultures, different people, and it brought this openness. But I still struggle with my colleagues when it comes to being open. And sometimes my openness may be offensive to other people, like they'll be like, no, this you shared too much and all of that. So um I believe that the more we talk about that, the more we have conversations around the fact that being indirect is not helping.
Mm.
Maybe yeah, we'll come to a point where we are able to share experiences and all of that. Yeah.
And what about your clients? How do you support them in opening up a little bit more?
um I think with patience
Mm.
with them, the fact of being patient with them and encouraging them. But also, if I come back to this patience, is really about appreciating the little that they shared and really making it big and appreciating them and also encouraging them to share more. I don't know for maybe you will tell me how it goes in your country.
Mm.
But for us, in my experience, I realized that maybe the third session of therapy, that's when a person will be able to share some portion of their deep um, feelings. Yeah, the third session. The first session and the second one, it's almost, you almost think that the client doesn't have any problem. You almost think, why did he or did she come to therapy?
Uh,
But because I know that, yeah, we take time. Yeah.
Interesting. I would say, well, I'm speaking, the United States is so big that we have a bunch of little cultures within a big one. So this is probably specific to my region, but I think a lot of people that come into therapy are ready to talk. But it depends on what. they're coming in for. Trauma is unique. There's well, often a shame component that silences people, and you have to
Mm,
establish trust. It might take a
mm,
long time, but
mm.
um, but um, there is. You may have noticed that Americans are kind of loud. So,
So they say. So they say.
yeah, it's true.
Yeah, I may say that for us, it's the opposite.
Yes, I've noticed
Yeah.
that. Yeah, it's very quiet. Even the volume of the voices in Rwanda are
Yeah.
they're very quiet.
Yeah.
Yeah.
Yeah. And for us, it is from the childhood, like our values. Yeah. You contain yourself, especially when you are a girl or dear. You go a lot of pressure. A certain
Oh,
way to sit,
mhm.
certain to speak with gestures, or you have to really contain yourself. Yeah.
Oh, yeah. And so that's particularly true for women, it sounds like.
Yes, yes, there's a certain particularity when it comes to women. Yeah, yeah.
Interesting. Well, we could talk about gender and all of that, but that's a whole other podcast episode.
Very true. Yeah.
Yeah. Um, okay, so let's see, what else did I want to? I am moving around. I'm trying to connect them a little bit. Um, is it okay? Well, I was going to ask the question around remembrance. Is that okay? Yeah, because
Yeah,
yeah.
absolutely.
So
Absolutely.
on the heels uh, of reservation versus being direct and communicating and all of that, there is this time of commemoration beginning April 7th that lasts 100 days. And this is my introduction for our audience. Feel free to correct me if I say anything wrong. um, eh, but this is a very sort of overt expression and embrace of sort of acknowledging what happened. And that is, I guess, from the outside looking in, it seems to be different from the day to day where we don't express and, we sort of contain emotion a little bit more. What would you say? I mean, during these times of collective remembrance and reflection, um, well, I don't want to ask that question yet. Actually, I'm sorry, Davina. Um,
Mm.
More organically, I wanted to ask about how does the 100 days of commemoration look different from or the same as day to day in terms of a willingness to express?
Mm, maybe I will start with what goes on during those 100 days.
Mhm.
Um, there was a time that it was really, really intense. But if I come back to this last few years, now the government made it a bit lighter, I may say. Now we
Mm,
take only 7 days, from the 7th of April to 13th of April. That's where maybe the remembrance can really be intense, where so the first day, the 7th, which is today, now we are remembering at the national level, and it is happening. The event is happening in a certain area, and this is being live on medias, and also, but in districts and sectors. Um, like all the activities, they must stop so that we go and gather there and we remember. So during the event, there's different activities that go on. We'll have the speech of the leader in that area, and maybe some testimonies of what went on during the genocide, songs, poems, and all of that, putting flowers to the graves. Um, and then after this, so it's going to go on for these 7 days. Then after those 7 days, each area will have a special day. So during these 100 years, no 100 days, I'm sorry, each district or each area will have their special date to do the remembrance. And we pick those dates depending on the significant dates where people were killed in mass during the genocide. Like for me, in my area, my district, we remember on the 9th of April. That's when they really killed like 3,000 in one day. Yeah. And like in Kichukiro, where there is my office, we are going to remember on the 11th. So the whole country, they have a special date to remember. And the rest of the time, it's normal. So you can hear songs on radios, um, on televisions, but the activities go on like normally. And I may say that like during these 7 days, it's a bit intense, the feelings, because we are really, really exposed to the remembrance. And we see that it's interesting to see that especially survivors, people who were alive during the genocide, um, most of them, we see the kind of relapse when it comes to mental health. We have people who are doing well the rest of the year, but when it comes close to April, people will relapse. They will really get sick, and they'll have this emotional crisis and all of that. Yes, so there's a bit of it's a bit tense, if I may say. Yeah.
Yeah, I can imagine there's a lot of big things going around with a collective anniversary that's publicly
Yeah.
acknowledged. I realized
Yeah.
today
And
is,
yeah.
yeah, April 7th.
Mm, mm.
Yeah.
Yeah, we are really, yes, we get to be exposed to that.
Mhm.
And personally, there was a time didn't, I was kind of avoidant.
Mhm.
And I believe there are some people who are like that. They avoid to remember, they shut down the radios and TV so that they don't hear those testimonies and songs and all of that. And then after a time, I think for me, I don't know if we will have time to go in my personal history.
Mhm.
So I started intervening during the commemoration period. In 2010, when I was a volunteer, I was a student in university. And from that period, I felt like I don't have time to remember, I don't have time to feel. So I became kind of avoidant, and I became numb. I numbed my feelings. And then it is interesting that in 2017, after 7 years, so remember that I intervened, I volunteered to help and to provide first psychological aid in the during the commemoration. So after 7 years in 2017, I really, how will I say, like I don't know where the all of a sudden during the commemoration, I don't know where the cries came from. I was
Mm.
actually surprised. I didn't know that I could cry that much.
Wow.
Yeah, like it was kind of a crisis. So yeah, we are exposed to the remembrance, but some people, especially in our profession, some people they really avoid the feeling, they numb their feelings. For me, I
Mhm.
used to think that I don't have time. Like I don't have that privilege to remember my family, and because I'm working. Yeah,
Oh, and
I
something
don't know.
shifted. Yeah.
Yeah.
What?
Something shifted in 2017. And a lesson from that is that um, I realized that I didn't do myself a favor shutting down.
Mm.
Yes, yes. Like I realized that I deserve to feel, I deserve to remember my family. Like, yeah, I deserve that. So I
Yes,
used
you
to
do.
take care of others and I forgot myself. And that was a great lesson.
Hmm.
From then, um, on the 9th of April, I have to go also be part of people who remember. Like I'm not in the intervention team. I'm just there. Yeah.
Mm.
Yeah.
Wow. Yeah. I just want to take a moment. Yeah, thank you for sharing
Thank
your
you.
story. Yeah.
Thank you.
And I mean, there's something about what you're doing in your profession when you yourself are, recovering and you share this experience with members of your community. I mean, I don't know how to ask it any differently. How do you do that? When you share the same story, it's not the exact same story, obviously, but the collective story is the same. How do you do that as a therapist?
Absolutely. Absolutely. I think, how do I do that? I don't know. I just be myself. I just told you that for a moment, I shut down and I felt that that is the right way to do it, helping others and shutting down my personal history, my personal experiences. But it's not an easy thing when now you allow yourself to feel. And when you meet people whom you share the same experiences and the same sufferings, um, it's not an easy thing.
Mm.
Like sometimes I know that I need to have this empathy, but sometimes I cross the line and I reach I don't know how to call it, but I really suffer with that person.
Mm.
And what I do, something called this self-awareness really helped me. Sometimes when I take my moment to really think and meditate about myself, I realized that I was really too much empathic and I crossed the line of suffering the other person's trauma. So what I do is to really come back and realize that it's not my story. It's not my pain. So I
Mm.
need to come back. And what helps me is really to limit the number of people I see per day. That I realize that it helps. And also I take time to transition from what I was listening to. And if I am going back home, I really take maybe 20 minutes, 30 minutes to be intentional to really shift yeah, to get out of that atmosphere.
Yeah, that's something clinicians talk about here too, is the transition from work to home and being intentional about how you approach that period, that little piece of time in
Mm.
between. Yeah. So, okay. And how, I'm curious if, having a shared collective trauma in some ways is also helpful in terms of relatability to your clients.
Yeah, yeah. I think there's also that.
Mm.
Um, there was a time it was really critical, I may say. People were really still in pain, and if they don't feel that, maybe let's take an example of a survivor of the
Mhm.
genocide. If he or she comes to the clinic, and if she feels that you are not a survivor, they will not they will not accept you as a clinician. So they will really look for a person whom they can relate to. And I believe that maybe it's kind of helpful for them.
Mhm.
Yeah, I but nowadays, now as we are evolving, in how we approach our history, what happened, and all of that, you see that now people don't care much about who is helping me, who is, yeah.
Oh,
But yeah, the fact that um, as Rwandans, we went through that as a whole, it's you feel that you are not alone. Yeah,
mm,
yeah.
yeah.
You feel that, yeah, yeah, it's there.
This might be a hard question to answer, but who is not a survivor? Like, how is that defined in Rwanda?
So if you go back to the history,
Mhm.
um, I hope that I will not mess this up. But if you go back to the history, initially before the colonization of Belgium, people, we had three, it's not ethnicities, but there was kind of tribes, three
Mhm.
tribes. And two of them were involved in the genocide. So one was Hutu, the other one was Tutsi. And Hutu tribe persecuted the Tutsi ones,
Mm,
and with the intention to terminate that tribe. Yeah. And that's why it is called the genocide. It was the intention behind that.
yeah.
Yeah. And
Okay.
the third one really was this tribe who used to be isolated. They used to be in forest and in other um, particular places, so they were not really involved in that. So the rest of the tribes were the ones who involved in themselves. And um, at that time, we used to call them ethnicities, but later on realized that it's not completely ethnicity, because ethnicity, you must be in a particular area and you must speak your particular language. But
Mm,
since these two tribes were sharing the same language, who were all Rwandans, yeah, they don't fit in that category of ethnicities. But
yeah.
yeah,
Okay.
those are the differences.
Yes, that's great. Thank you for
Yeah.
explaining that for our audience. I appreciate it. Okay. I won't keep you too much longer, and I'm not going to get to all the questions, but I did want to ask um, this question. During these times of collective remembrance and reflection, resilience can be both tested and strengthened. How do you personally and professionally navigate that balance? I know I kind of asked that already, but specifically during this period, how do you do that?
Uh, yes, I agree with you when you say that this resilience can be at the same time challenged, but also strengthened. Um, So, like personally, how I navigate that, I think it was a journey, first of all. It was a journey for me, from the numbness to the shift and the understanding that I have the right to feel, and the understanding that by allowing myself to feel, I'm allowing myself to heal.
Oh,
So there used to be a time that I would really avoid, not feel, acting as if I'm not concerned, as if, yeah. And now I know that feeling for me is not dangerous. So I'm allowed to feel, I'm allowed to have a moment with my family in the remembrance. So working on that part really helps me, and I feel that it strengthened me in one way, and gives me this resilience of and be able to help others. So I navigate it by allowing myself a time to be kind with myself, and to be able to feel.
yeah. I like what you said. You need to feel to heal. Yeah, that's a hashtag somewhere.
Yeah, I learned it the hard way. I learned it the hard way.
Yeah.
Yeah.
Oh. Do you, yeah, I want to be really respectful of your time, so I'm not going to ask you any more questions. Are there any questions you have for me or anything you want to say that I didn't ask?
Um, hmm, I don't think so. Yeah, I think we tackled all the things that I was thinking in my mind. Um, Maybe for the clinicians all over the world, but in particular Rwandan professionals, um, it's very important to be kind with ourselves
Mm,
and being patient with ourselves. And, you know, imagine you are having a breakdown and you are a mental health professional. It's something that is very difficult to deal with. Uh, but we need to be patient with ourselves. We need to remember that we are human beings before we are mental health professionals. Yeah. Like the reason why I say this, you when you meet mental health professionals who are struggling, let's say a mental health professional is having maybe a child who is struggling with mental health.
mm,
I believe that in my experience, I realized that as mental health professionals, we become very guilty about that.
mm,
So we forget that we are human beings before we are mental health professionals. So it's very important to be patient with ourselves, to be kind with ourselves, and to allow that, I mean, to understand that things can happen also to us, and it's not it's not the end of the world. So we
mm.
need to step back a little bit and accept help. In 2022, I experienced burnout. I was working in the international organization that I mentioned earlier, and so I went for counseling, and I realized that being a client when you are a mental health professional, it's not an easy thing. At least for me, it was very difficult to open up.
Mm,
It took me a long time to be able to open up to my counselor.
mm.
So yeah, as clinical psych, no, as mental health professionals in general, we really have to be patient and kind to ourselves.
I
Yeah.
appreciate you saying that. Somehow we came to believe that we're not allowed to be human, but that's really what helps us connect to our clients the most.